After more than 900 days of pandemic controls,
I look forward to a really constructive discussion.
the clearest sign yet, the end may be in sight.
There's not a role for government in running every bit of people's lives forever.
Meeting for 2 hours, the nation's leaders swiftly cut one of the mainstays of the pandemic response, deciding from mid-next month, Australians with COVID won't have to stay at home.
We are changing our position based upon changing advice and changing circumstances.
That advice from Chief Medical Officer Paul Kelly submitted to the Prime Minister, notably without input from his state and territory counterparts.
Isolation itself cannot be seen in isolation. It needs to be seen in the context of that high vaccination rate.
But while the nation's leaders are unified,
today was the most constructive COAG style meeting that I've been part of.
The country's doctors aren't all convinced.
I think people who are pushing for the isolation periods to be cut are not scientifically literate.
It's a disappointing, pretty dark day, actually.
The support for people without sick leave will also end next month for everyone but high-risk workers.
It isn't sustainable for government to pay people's wages forever.
Nobody should be left with that terrible and impossible choice about whether they do the right thing to stay away from the work when they're sick or whether they've got enough money to live on.
In Europe, the easing of COVID-19 restrictions saw a jump in cases, but that was at a time when infection rates were high. The Chief Medical Officer stressing Australia's much better placed, but reserving the right to bring back restrictions if needed. The message, though, remains the same. People should stay at home if they're sick. The nation's leaders and the health system are relying on it. Stephanie Dalzell, ABC News, Canberra.